Okay, I'm back. So, there's a few things that I wanted to talk to you guys about that either I didn't get the chance to cover yesterday because I had so much stuff to talk about with you guys to try to cover my first month. So, whatever it is that I may or may not have forgotten to mention, I'm going to mention it now. Okay, so my first 30 days, there were a few things that I did experience. Like I did experience, and I'm still experiencing acid reflux. I think it's as a result of the muscle repair. I do get that a lot sometimes at nights, which is, I get up like 2 to 3 times at night because either I'm having some kind of acid reflux type of a situation, so I have to kind of like sit up and burp, and then after a while, then I feel a little bit better, and then I'll go back to sleep. So I still, some nights I'm able to sleep throughout the entire night without sleep aids, and some night I'm just not. Again, I think I mentioned in my 1 month post-op video that there's some nights I do sleep in my bed, and I have one of these beds that go up and down, but at the same time it's just not the same as me sleeping in a recliner or a chair. So some nights I do sleep on the couch with the recliner, and I'm able to effectively sleep for the entire night, and some nights I'm able to just knock out completely in my bed in an elevated position. So it varies. You're gonna go through different uh, issues at different times. But I am going to stress the importance of having a support system when you do come home. When you come home, it's not going to be easy. You will no longer have a bell to call a nurse to help you. You're pretty much on your own if you do not have the support of, a loved one, a family member, a husband, a spouse, a boyfriend, whatever it is, girlfriend, boyfriend, who knows. You are going to need help, especially if you have younger kids. Bending down, picking things up, doing laundry, standing at a sink, like washing dishes, all that stuff is going to be challenging. Like I am now 1 month post-op, and I could effectively say within the I today is like one of my best days in terms of giving my daughter, a bubble bath. She loves putting her swimsuit on and going in the bathtub like it's a pool, and just, so it does require me to bend down. It requires me to pick up, you can hardly pick things up that are really heavy. You're not supposed to begin with, but at the same time, bending is still a challenge. You have to use your legs versus your stomach muscles a lot. Coughing and sneezing still hurts. It doesn't hurt, as much as before, but it's still some level of discomfort. Um, so what I didn't show you guys. So just pretty make sure that you know that you are gonna need some level of support system at home for at least a month or so. Cleaning, I have not really started doing that yet. I try to pick up, I try to fold clothes, I try to do, certain things, but I go to the store, I do buy things, but once I get home, my husband comes out and get the heavy items for me, or my son. But at the same time, you are going to need some support. And remember, you are going to also need support in terms of to help you cook your meals, or to buy stuff to put in the refrigerator. Help is definitely going to need it once you have a tummy tuck. Once you have just lipo and a BBL, at some point in time you're going to be able to bounce back real quick. But having a tummy tuck, it's a longer recovery period versus just a BBL and lipo. Okay? But this is actually the pills that were given to me, the sleeping pills that was prescribed to me by Dr. Medina, and was held onto by the recovery house. So this is the brand of the sleeping pills that was given to me. You see they put my name on here, spelled it all wrong, but that's all right. Okay, this is the brand. I just had, I think, the paper, but I had to buy some more today. But this is the brand of the non-stick gauze that I felt, or I feel, is really good for your incisions, like your belly button, your drain exit site, I guess. and whatever areas. These ones are really good. So I had to buy some more today. By the way, whenever you get back home, did you see that bag that I had with all that gauze and those gloves and those creams and shit? I went through that. So be prepared. You are gonna make sure that you buy all that stuff before, because once you get home and you're on your own and you got to change your dressing every other day or every whatever, and you don't have this stuff, you're going to be struggling going to the store to try to find it or explain it to someone to get it for you. This is really good. This is the rolling gauze that I told you guys about, which is really good for your tummy tuck incision. I felt that this was the best because it pretty much just rolls and it's really soft, and you know, it stays in place, which it did. So you're gonna need this with some kind of tape, but this I felt was really good. Okay, so what have I been doing? Have I been doing scar therapy on my areas? I did mention yesterday that my area is pretty much 95% healed. I have not been using on the areas that have been healed already. I have not been using no kind of scar therapy tape or nothing. What I have started using recently is just, well, I've been kind of using it on my back a lot, especially like my lipo areas or whatever, is I started using this first, is 100% coconut oil. You know what, like my dad had bought me this, like it's from India somewhere. It's like it's unrefined coconut oil. It's 100% natural. I'm sure you could find this in any Whole Foods, and you know, this coconut oil stuff is selling like off the shelves all over. So I've been using this a lot on my skin, on my back, on, you know, I have not used it on my incision at all, but I have been using it on my back or my lipo areas, my inner thighs, stuff like that. In terms of my areas that are already healed, my incision, I did order, which I'm starting to use now, is rose hip oil. I did get this from Amazon. To be honest, almost 98% of the things that I purchase is on Amazon. So whatever I have shown you, believe me, go to Amazon.com and type it in the search bar. It will pop up. This will pop up also. So this is what I have been using. I just started using on the areas that is already healed. Just to keep it moisturized, and I heard it's pretty good with scars. And then I have been using bio oil. So one day I may use rose hip, another day I may use bio oil. I do not combine the two together because who knows what the hell is going to happen. So I have not been using both together. One day I'll use this, another day I'll use this. Once my drain site fully heals, then I'm going to perhaps use these two for like a week or two, and then I'll jump into scar therapy. But once I start scar therapy, I'm going to share that with you guys. I do have a few question and answers, which to be honest, I don't mind you guys asking me questions all day. There'll be times where when I find the time in between work-life balance, I will sit down and I will answer all your questions. I don't mind. I'm like 100% patient. I'll answer the same questions over and over. That's just me. It's in my nature. But I did write down a few questions that you guys asked, which I think, you know, I may have covered it. I may not. I may have just rambled over it. Who knows? How old am I? So we're going to go through it really quick. I'm 39 years old. I will be 40 next year. What's my status? I am married with kids. Where do I live? I live in South Florida area, which is a little bit north of Miami and, you know, south of Fort Lauderdale. I'm in the middle. When did I get my lap band? I got my lap band December of 2015. What was my weight at the time of my lap band? I was 220 pounds. And the reason why I was 220 pounds was I got my lap band through my insurance at work. You know how these places work, right? They want you to stay in order for you to get approved You need to stay at a certain weight, and you don't need to exercise. You don't need to do nothing. You just need to stay. So it was covered by my insurance 100%. I had to stay at 220 pounds for about 6 months. I'm just letting y'all know. My eyes twitching. Anyhow. Why did I pick Dr. Medina? I picked Dr. Medina for several reasons. I found her on Google. I Googled best female plastic surgery surgeons in DR, and she came up on Real Self as well as Dr. Almonte. And I started researching her name, started researching her work. I immediately opened up an Instagram account because I was not on social media. I opened up an Instagram account to ghost her to see what she was about, what she was doing. I had my assistant at work follow her on Snapchat because that was just too much social media for me to keep up with. And then I opened up a Real Self profile, and I realized that she was consistent in terms of her work. I liked her work. I liked how thin her tummy tuck lines were. So I picked her because of her consistency, because of her tummy tuck line, and because of the fact that her husband is a bariatric surgeon. And I needed a doctor to be experienced in working with lap bands. I have a lap band, and if you don't know what you're doing and you go to a doctor that's not familiar with a lap band or what they are going to do with your lap band, with your port once you have surgery, we have a problem. Because one of my main concerns when I met with Dr. Medina in person, I told her I'm concerned about my lap band. I knew my lap band at the time had fluid in it. So she's like, no need to be worried about that. We're going to extract all of your saline before surgery. If you have a lap band and you're about to have plastic surgery done, you do not need to have no saline in your band, because your band can potentially rupture and you don't want that band to rupture. So make sure that any doctor that you pick to go to is knowledgeable about how to deal with your lap band. Make sure that you don't have no saline in that lap band before surgery, and where are they going to reposition your port, and are you going to be able to see your port once it's repositioned. Make sure you ask those questions, because no one wants their port to be poking out, to be showing when you just had a brand new tummy tuck and you got rid of all those scars that you pretty much had to endure by getting yourself a lap band. So make sure you look into that. So I picked Medina for those reasons. I already answered that. Oh, and by budget reason too. She was within my budget. And that's why I picked her. Did I have a patient coordinator? No, I was my patient coordinator. I reached out to Dr. Medina. I sent her my pictures. She sent me my quote. I obtained my deposit info. I pretty much like to do things myself because I need to blame myself if things are not done the way I like for them to be done. What did I have done? I had a tummy tuck with muscle repair. I had lipo of upper and lower back and my flanks. I had my inner thighs done, and I had a mild BBL. She did not feel I needed a huge BBL because I did not want a huge butt. I wanted to look natural. And I think she delivered that well. And I wanted a teardrop kind of butt, which is like the bottom heavy. I did not want a shelf butt, which is more higher. And I did not want hips at all. She said I already had hips. She said I already had a butt, and if I did not want to look fake, which I know I'm having plastic surgery done, but still I don't want to look fake. She said I did not need a bunch of fat in my butt. How much did I pay for the extra areas? $300 for both inner thighs. When did I resume sexual intercourse? Man, y'all trying to get up in my business. Okay, so let me answer that question. I attempted it at 4 weeks post-op, but I did it in my faja. I was not going to take my faja off. I'm really sorry. If you want to go there, you're going to have to kind of go with the restrictions that we got upon us, because I was scared to do it in my faja. But now we're good because my incision line is 95% better. He, can't touch the right side. And remember, it's a little rough because your whole back is lipo. Things might get a little rough. So you just gotta make sure, y'all take it easy. Y'all just take it easy. That's all the questions that I have for you guys so far. I try to answer as much questions as possible as they pop up because I don't want them to pile up on me. So pretty much that's about it. Again, my videos are in no way, shape, or form advertisement for Dr. Tanya Medina, Dr. Almonte, Recovery House. I'm not being paid. This is not promotional videos in no way, shape, or form. I'm just an individual that chose to go to DR to have surgery done and chose to document my surgery and share it with you all. If you all would like to go ahead and launch your own respective YouTube video documenting your respective journey, I do encourage it. Do not feel by any means necessary because I have covered A to Z, which I hope I did. That does not mean that you may not cover A to Z with your respective doctor who you're going to, because I mainly have covered my experience with Dr. Medina and my respective research. There's a huge network of you. There's a huge world out there with different people, different walks of life, different, who research differently. They may respect your insight or your views on your doctor or your journey. So feel free to go ahead and, pick things from my video, launch your own respective YouTube channel. I will support you. Let me know what it is. And go for it. Remember, we do have a Surgery Buddies page that was launched based on our experience or my experience with my Surgery Buddies, and that page is monitored on a daily basis, and we do actually try to make connections for Surgery Buddies. We do encourage, once a suggestion is made for you guys, please reach out to your surgery buddy. Please look out for each other. This journey is pretty difficult. It does get lonely, it does get hard, and everyone needs someone when they're having these types of procedures. Again, if you have any questions or concerns, please go ahead, email me surgeryjourney@gmail.com or comment below, and I will try to respond to you as quickly as possible. There's also a post on Surgery Buddies. If you have questions and concerns, you can also post them there as well. That page is only set up for people who has made their deposit, and it is going to have surgery for sure. If you do have a date, whether or not you choose to reschedule your date or not, you're still welcome on that page. Or if you just want to ghost the page, you could ghost the page as well. Okay, thank you guys. Have a great Sunday. I'm not doing any more videos. I'm chilling today. I'm in my stage 1 faja, and that's it. Bye guys.